sometimes some people go so hard so fast and get an injury that their speed, their load, or volume was too much too quick, and now they have negative strain. So what we have to do is figure out where they're at and what they can do. So for instance, let's say someone hurt their bicep. Well, there's a lot of things you still can do, lower body, core-wise.
That you can work around.
Yeah, and you can keep moving. So can we train through that? 100%.
Hey, what's going on? Welcome to Healthy Living Wichita podcast with Go Time Training. I'm your host, Raymond Elliott, lead personal trainer at Go Time Training in Northeast Wichita, Kansas. I've been in the fitness industry for over 20 years now, and I've seen it all. This podcast cuts through all the fads and gimmicks to give you a science-based truth on all things fitness and nutrition, so you don't have to try to figure it out on your own. If you want to live happier and healthier and get the scoop on how to work out, eat right, and keep a positive mindset, you're in the right place. It's go time. Now, let's get to the show.
All right, so we're here with Healthy Living Wichita here. I'm going to look at my phone to see where I'm at, but no. Healthy Living Wichita. We have our wonderful guest, Keith Sparks. So if you want to tell us a little bit about yourself, introduce you to the world out here. This could be all over. This could be like Asia, Africa, or all. No,
we'll see where
Wichita.
it goes.
You never know. Who knows?
You never know.
Yeah.
Like I said, my name's Keith Sparks. We have 2 locations here in Wichita. We're chiropractors by trade, but a lot of stuff. When people come into our office, what they really realize is we're chiropractors, but we do a lot of advanced, what you think of as physical therapy type exercises and services, and we really like blending those together under one roof because there's advantages to both. Pros and cons to everything, right?
Right, yeah.
Whenever we can integrate both of those services into one cohesive model, we're just more effective. So we really love that style of practice for us.
Yeah, I always like the term co-management.
Yep.
I just think that's such a huge thing, and I think there's such a part where you're talking about physical therapy, chiropractor, massage therapists, personal trainers, that whole comprehensive, like you said, nature can really help people because there's lots of things that you can do that's just out of my scope of practice. I can't, but there's things that I can do with my clients that will complement what you're doing, and they're going to really see the best results.
Yeah.
So
it gets frustrating a lot of times. I'll only see in the medical community. It doesn't necessarily matter where it's at. If we go to seminars, like we're going to a seminar for BFR actually this weekend, blood flow restriction. Yeah. Excited for it. But a lot of times we'll see it where people, let's say someone only has $100, something like that, and they're just like, I want all of that $100 versus doing what that person needs. Sometimes it's getting to a personal trainer. Sometimes it's seeing a functional medicine doctor for nutritional stuff. I know you guys have Casey here to help with that.
Right, yeah.
Or a chiropractor. And it's unfortunate because a lot of times at the end of the day, the only person that loses is the client.
Right, yeah. People become greedy, and I've always tried to think of that aspect. My motto for myself has always been help people first, make money second. So I've tried to always keep that. So if it's something that I can't do personally and say potentially I lose somebody or they would go to a competitor or anywhere else, my true concern is that I'm helping people, and that's why we started Healthy Living Wichita. Is the whole idea behind this is to help the community be able to have a farther outreach. We don't make money from this, but it's the same thing. If somebody came to me and I couldn't do something for them because it was out of my scope of practice, or I wouldn't want to try to lower my integrity and say that I could when you could, or we could co-manage together.
Or someone else,
or someone else.
Get them to the right place.
Exactly. So. We're supposed to have a topic here, but you said BFR, and I really like blood flow restriction.
Yeah, cool.
I've done that quite a bit. I actually think that it helped my bicep peak.
That's awesome.
Size.
Yeah.
I've done it on the calf and the quads. Really, the calf is almost unbearable sometimes. But I had the course that I put on the ones I got them off Amazon for like $5 or so cheap.
I should be asking you then.
I don't no. That's a cool little concept. Maybe another day we can have you back and we can discuss BFR training. It works great for people, especially with injury. When I had tennis elbow really bad, and I still wanted to be able to hit my biceps, but I couldn't do barbell curls and a lot of other things. I was able to do banded or cable curls at a lot lighter weight and still see a lot of hypertrophy. So we'll save that for another time. But speaking of my tennis elbow, bilateral epicondylitis, working through injuries. That's kind of the topic that we really want to talk about today. And kind of go over some of those things with you. So what is your thought process on working through injuries?
Like anything, if anyone that comes into our practice, my answer always is it depends. Like it's just the honest answer.
It is the honest answer so much. It's so hard.
So the way I look at things, and unfortunately I think it gets missed a lot across all ends of the health spectrum, is I look at everything as strain. Everything. Like, let's say for positive strain, like you want to get bigger, stronger, leaner, toned, whatever it is.
Right.
You have to put your body through strain to achieve that.
Yeah, you do.
So, and let's break down like the deadlift, for instance, because I love the deadlift. It's my favorite lift.
Mine too.
Yeah, man, it's where to go. But strain always happens the way I look at it in 3 ways: speed, load, volume. Okay,
right.
Like if I'm going to put more weight on the bar, I'm going to do more reps, or I'm going to move the bar faster or slower depending on what type of strain I want to put on the system. Right?
Yeah.
What happens a lot of time, and if I had a whiteboard, I'd draw this out for you because I love drawing. I love drawing.
We need a whiteboard.
Yeah, it makes things so much easier.
There it does, yeah. We actually have a few of them, but...
Good. Yeah, hey, I draw all the time. But I look at it, and I put that into like a Venn diagram, and in one circle I have pain, and the other circle I have performance. So with what we do, largely lives in the pain world.
Right.
So let's be honest, like if someone's going to a chiropractor, they're not... Most of the time, like, sure, we get people that's looking for increased performance or better movement patterns, but a lot of times they're coming in for pain.
Yeah.
Where for you, they're coming in for performance.
Most of the time, yes.
And we can both see and agree, like, there's an overlap between those.
Oh,
right?
Yeah, definitely.
For instance, like, a lot of times if you go to a traditional physical therapist and let's say you have low back pain, they might start you with McGill's Big 3. Yeah. Like doing glute bridges, dead bugs, bird dogs, stuff, side planks, stuff of that nature.
Yeah.
Or you can also do that with personal trainers, right? Yeah. So for us, that's
the where we curl up.
Yeah, like we could go down the road. Like check out the Love It sit up sometime.
Really?
Yeah, check it out. Just a little drop on it.
Probably 3 books by Dr. Stuart McGill.
Yeah. Oh, he's a great little biomechanics specialist.
He's
an amazing beard too. If anyone's watching, but sorry, going back. That's a little tangent.
I'll do those tangents. I'll try to keep you on track. Okay, back to where you're at.
So if we go back to like strength, speed, load, volume. Sometimes some people go so hard so fast and get an injury that their speed, their load, or volume was too much too quick, and now they have negative strain. So what we have to do is figure out where they're at and what they can do. So for instance, let's say someone hurt their bicep. Well, there's a lot of things you still can do, lower body, core-wise.
That you can work around.
Yeah, and you can keep moving. So can we train through that? 100%. But let's go to the extreme of this, and let's say you ripped your bicep off your muscle, or off your bone, correct?
Yeah, it scares me every time I deadlift.
Yeah, no, don't be afraid of it. Like, keep lifting, man. You're better for it, I swear. But let's say that happens. Well, then should we be doing bicep curls for this instance? Well, no. That makes obvious sense.
Right, yeah.
But we want to then, let's say if there's a surgical intervention that's needed in that situation, what do we do to get it back where it is?
Right.
We restrain it.
Yeah.
That's it. And you're just trying to figure out, even in the chiropractic or physical therapy world, is we need to put speed, load, volume on it to remodel it so you can get back into the gym and doing the things you want to do.
Right, yeah.
So the principle is the same.
Same, just a systematic approach to it, right?
Yep.
So you just have to figure out where that level is, what you can do, and then push it back to that area. That's pretty cool.
Yeah, same thing though.
So I mean, you guys obviously, what is your thought process on like having, because like we were talking about, like a specific a systematic progression is what I like to call it. And that's why I like to start with people and try to explain it. And we're going to start at this level, and we're going to systematically progress you all through. There's a rhyme or reason for everything. And I imagine that has to be a lot when it comes to chiropractor, or putting somebody that has through pain, because there's got to be a starting point and kind of an end point in a journey through that. How important is that for...
Critical. Like you could say it's honestly everything. If you don't know where someone's starting at and you just throw them in to whatever, you don't know if it's going to be favorable or if you don't know if it's going to get worse. So if you take just this blind shotgun approach, you could mess things up even worse, and you never know where you're really starting from. So you're always going through muddy water, and that never wins. Like you have to have an exam. Like a lot of times people think of, if I'm going to go to the doctor of some form, I'm going to get an exam.
Right.
You guys do very similar. You put people through like movement patterns and seeing where they're at. Yeah. It's the same thing. So we have to have a understanding of a starting point and then move through it.
Yeah. Yeah, and I will sometimes err on a lighter end in the safety, because that way you can go through. I think a lot of people want to start a little bit too hardcore. Even injury. I think some people that have injuries like understand that, and they're like, okay, I know that I need to start here. I don't want to go. But everybody, and I can get it. People want to kind of push through, and that's a lot of times where those injuries even happen. If they don't have injuries, that they try to go a little too hard. But it's nice to, like I said, systematically progress through those, and people see a lot more change, benefit. It might take a little bit longer sometimes. Probably not in the pain world, but maybe in the composition change world. But they're going to see a lot better, and they're going to be able to maintain that and continue on a lot longer.
The way I really I break everything down like bubbles. Literally, like everything is bell-shaped curve. Okay. So if you a little bit of a tangent, but if you look at stocks, anytime a stock hits a really good recession, it's about a 42% drop. Okay.
Okay.
If you go beyond that,
specific number.
Yeah, it's a very specific number. If you go beyond that, let's say a depression, you're about 85% of a drop. So it almost doubles it.
Right.
So let's think about that in the world of injuries. It's the same thing. If you strain too hard, like speed-wise, the load's too much or the volume comes at you too fast with it, you're going to get hurt.
Right.
Right? So you're going to get, let's say, a strain probably. You're going to drop at 42%-ish of what you could do before. Right. So you have to build back up. Let's say you tear your bicep. Well, now you're at 85% of, let's say when you can start moving it, you're about 85% of what you could do prior. Right. And so you have to build it back up. Yeah. The best athletes, I don't care who you are, the best athletes in the world, whatever sport it is, understand that principle intuitively or somehow they were taught it. Because if you can keep improving in micro bits over time, that's really who wins because they never got injured.
Yeah.
And so they could keep pushing through it.
That's huge, yeah.
So it's the same thing that we see in injuries. If you just get let's say a moderate tear for just this discussion.
Right.
Yeah, you're going to have to drop to some degree. And that's where you're trying to figure out where can you restrain it at to build them back up to where they were before.
You have to find that level, and I think that's probably the beauty in the part, and that's probably where the education and those things, and a lot of self-awareness, right? You have to be honest with yourself and kind of throw away your ego and have an understanding where you
It's
start
hard doing that, though.
It's very difficult. With a lot of my clients, like I said, I prefer to err on safety or a little bit lower so I can build them up. I'm okay with starting a little bit behind and getting them there versus starting too far over.
Yeah, and you're smart for it, too.
Yeah.
Honestly.
Taking them through as far as they can go, because it might take a little while, but it's worth it all in the end to start there and find out where somebody's at. And it's also nice to show those progressions continue to go on and move and show that those small increments going forward.
Yeah, everyone wants the results. Like you said, everyone wants it now, right?
Yeah.
But if you get everything you want now, you never appreciate it nearly as much.
Yeah.
And if the one thing too, let's say if you're paying for a service, you're going to get fit or you're going to get out of pain.
Right.
Everyone wants the results as fast as they can. But if they go negative, they're gone. And if you push that too hard as a practitioner, you can't actually get them to where they ultimately want to be. And what people care, if they tell you or not, what they care more about is the results versus the cost or the time.
Right, yeah.
Because if they get the results, they're happy in the end. If they get hurt, they're gone.
Right, yeah.
It doesn't matter in which situation it is, they're gone. And that's super frustrating.
Yeah, a lot of people actually want a moderate intensity exercise, and then also you don't want to hurt people because you're basically taking them backwards.
Yeah.
So it's ready to take somebody forward and continue on versus reversing that situation and then having more of an issue, and then you have somebody that's not happy at all and they're done. So that's all good stuff. So going through with some pain, what are some things that you guys do? I mean, like I said, it is all contextual. It's always going to be different. It's always depending, which is the hardest thing. I can never answer a question because I start to answer it, and then all of a sudden, 7 other scenarios pop up. I'm like, but in this case, but in this case, so it's very difficult. So I can never answer anything, which works good because it makes me critically think on stuff, which I think is beneficial nowadays in the world. But it also can be a problem. But what are some things that you and your chiropractor that you can do to help people through pain, or some things that maybe they can even do?
Yeah.
Is that a loaded question?
It is totally a loaded question. We could go hours on this topic. So I'll start with saying one thing first, and it's a quote of a mentor of ours. I love him to death. His name's Dr. King. He has a quote that says, "Everything should have system besides the patient's care." And I love that so much is because...
That's a great saying, I like that.
Yeah, because let's be honest, if we can create systems, even if it's, let's say, FMS or SFMA, there's a movement analysis to it, it can help us unmuddy the water.
Right.
But if we trap ourselves in that, then we get stuck. So we have to have wiggle room within it and just really focus on the patient's care first.
Yeah.
So for us, a lot of things when it comes to movement-wise of getting someone out of pain, because I largely think of... and I'm going to try to make this a little bit simple for this discussion, is...
we have extremely intelligent people out there. They're all out there now. It's always nice to clarify. And sometimes we get in trouble in here by doing that, especially me and Jake. We'll kind of geek out and we'll get super sciencey really quick.
Yeah. He's like, wait, who are we talking to?
We want to help the community. Not saying that they're not intelligent, but not everybody knows everything in those aspects.
So let's say we throw out anything psychology related for like for pain.
Okay.
We have largely 3 types of pain fibers. We have, categorizing wise, mechanical, we have chemical, we have thermal.
Right.
First, we need to realize what's going on, because let's say you touched a hot stove with your back. Me adjusting your low back is not going to help at all. Like that would be silly, right?
Right.
Typically, what you want to do is do the opposite. So it's kind of like principle of yin yang. If you do the opposite, you give the body harmony. It gives it balance. In medical world, we call it homeostasis, right? Yeah. So let's say I touch a hot stove. I put my hand under cold water. We give the opposite to help it. Right. If you get inflammation going on in your body, what do? You give it an anti-inflammatory. Right. You give it the opposite to reduce it. Right. So if we have pain that's going on due to mechanical causes, we need to understand that it is mechanical pain. If we can at least classify it as that such first, we can win. From there, we want to identify, for us at least, always, is a way you can repeatedly load the tissue, you create strain to it, that starts making it feel better. Okay? Very simple starting point, which a lot of times people don't understand it. They intuitively get it, but they kind of miss the volume aspect of strain, where they'll do something that helps, but they're missing the volume, where they need to do more of it to create the positive strain. They noticed their body liked it.
Right.
They just didn't do enough of it.
Right.
And sometimes it's just for us coaching to do more of it.
Right.
So going to it, let's say someone comes in with mechanical pain. We want to find a way that they can repeatedly load the tissue to start making it feel better. And a lot of times that's the starting point for their pain reduction exercise. So going back to that Venn diagram, we got performance, we got pain. We need to start with a way to repeatedly load the tissue to move it across that Venn diagram into performance and get out of pain.
That progression through.
Yep. And it's simple. If you do too much too fast, you overstrain it.
Right.
You get worse.
Right.
It's typically one direction of repeated loading that will make it feel better.
Really?
Mm-hmm.
One direction.
It's very, very simple. Yeah. Break things down.
Yeah. I like simple. And sometimes it is that way. Sometimes people try to make things way too complex, and a lot of times when you come into it, it's really the simple things,
rubber belly,
basics. Yeah. That are beneficial, and you don't have to do 452 different things to get relief. You can do just the same thing and practice that and be consistent on it.
Yep.
And a lot of times that is the beneficial factor. So
slowing things down, man. We all like to get fancy, like. Let's be honest, fancy sells.
It does sell.
It's marketing.
And I think as personal, just talking about exercise period, these are things that I talk about with my team, because we want to challenge people, we want to give people creative, we don't want to give something that they can just pull off bodybuilding.com. I understand there's an enjoyment, not trying to say that, there's an enjoyment factor to exercise.
Yeah.
And I think it's probably a little bit different in pain because people are not looking for those same things. But really the basics, the foundations, and that's when I said with everybody, my goal is foundations. I want to succeed in those. And if we have to err back a little bit, like work through some movement patterns, work through some activation, work through some neural control to get to just the foundation. That's all my goal is. Once we get the foundations, then we can add upon that. But that's a lot of basics. And then you'll continue to do those forever. So the basics are important. But sexy cells and crazy this. And we're going to do a one-legged stability ball.
Like, for instance, everyone wants to have a 500-pound squat, right? Or deadlift.
Right.
Well, if your pattern's off, are you going to get there? No, because more than likely you're going to, you can, but more than likely you might get injured.
You're going to get injured.
And so then you have to step back, and then you have to keep, and so that everyone gets in this yo-yo effect.
Yeah.
For you, if you clean up the pattern, can you get there easier? Most definitely.
Yeah, it might take you a little bit more time, but you're going to get there where you might not be because you're, one, going to break down probably your weakest link.
Yeah.
Two, you might have faulty nerve control, so you might even have the proper muscles. And then just your, I always think of it kind of like horrible scaffolding. Like once everybody gets good form, everything's strong, and everything's kept neutral, you can load on them. But when it's not, it's it's kind of like a newborn gazelle.
I don't know. I like that scaffolding. I like it.
Yeah. So that's important. So how do you feel like personal training can co-manage? And how can we really work together? How can I refer to you, or vice versa if we need to? And how can we best serve the community of Wichita for us?
The way I look at it is to some aspect, are people maybe going to have to load tissue, let's say exercising through strain? Yeah. We need to figure out, though, is it strain that is just muscle soreness, or is this strain that you need to take a step back so you can actually move forward?
All right.
So for us, going back to that Venn diagram analogy, because I think it's so important, is there's an overlap between, let's say, chiropractic and physical therapy with personal training. Because taking a little bit step back here, let's say someone comes up into us with pain because they've been trying to improve their health and wellness and performance, right? We want to get the client there, okay? So there's this sliver in the middle where there's definitely overlap. But if we go too hard too fast, we need to remodel the tissue.
Right.
So that's kind of where we come in.
Okay.
As you get out of that pain pattern and you start segueing forward, and you might still have a little bit of pain,
right?
Because there's that sliver, there's that overlap. We start co-treating between the two of us, and you guys, because it's more cost effective, in all honesty, for someone to go see, at that point, a personal trainer than going to see a chiropractor or physical therapist.
Right.
Like, you don't want to pay $60 for, let's say, a 30-minute session when you might be able to pay $100 for an entire month of personal training. I have no idea the cost. I'm just,
it's not quite. It's not
but
you
know where I'm getting at.
right. Yeah.
It's just smarter for the time to start going that way. So as people get out of pain and they're in a tolerable level, maybe like 3 out of 10 or 2 out of 10, we need to start co-treating. As that pain is no longer there or pushing like a 1 out of 10, go to the gym.
Yeah. So you
like
think,
segue.
Once again, this is going to be depending, but you think there's potential to work in pain as long as you know what that level is and you know where it's coming from.
Yeah. What is the movement pattern that hurts it?
Right.
For instance, like, sounds crazy. Maybe I do a bicep curl and it doesn't hurt it, but if I do a pull-up, it does.
Right. There's a difference. Between,
And understanding if that pain is actually coming from the bicep or is that pain coming from a referral pattern. And let's say the rotator cuffs.
Right.
A lot of times rotator cuffs will send pain into the anterior part of the shoulder
right. Yeah.
and going down the arm.
Yeah.
So it might not be, the pain might not be, or the problem of the pain is not necessarily where you feel it, but somewhere else.
It's not always where it's located.
Yeah. So we need to understand what movement pattern it is and break that down more. And then if we need to do like dry needling or cupping or, ART, all that type of stuff, whatever it is, that's where we come in. But if it's, we need to maybe alter the movement pattern, that's where you guys come in. So there's 100% overlap between the two.
Right, yeah. So that's where that sliver comes into play. Yep. You guys have kind of got, you directed, you know where it's at. You got the person to 1 out of 10.
Yeah.
They're starting to kind of work through
2 out of 10. Yeah, it doesn't even have to be 1.
And then we're going to take them through and try to figure out. I always said to like trainers, like that's where really the genius comes out is when somebody does come in with some pain, but you're able to either work around that.
Yep.
Or figure out what needs to be done, but still give them a worthwhile workout where they're still seeing results.
Yep.
That's a very difficult thing.
So that's
I think
really what they want
trainers to do. And that's where the genius comes into place. They work with able-bodied people and give them a good program. It's awesome. And there's probably some science and knowledge to that's beneficial from one to the other. But really being able to address somebody in that way while they're co-managing, working with you and being able to do both. You're still getting treatment here. You're still getting better. But you're able to exercise and work around those patterns. Residual pain, some things that I also look at for clients, because sometimes I'll have clients that come in and during it doesn't seem to bother them, but I want to address does it bother them the next day, and sometimes it doesn't, and we have to figure out that. Okay, well, that didn't bother you during, but for some reason 2 or 3 days later it does, so we're going to have to back that out of there and figure out what the next movement pattern that works around it.
Typically in that situation, we call it, they need to reterm these, but we call it a dysfunction.
Right. They're trying to change that. Trying to change that name. We're the same way in dysfunctional movement patterns.
Yeah.
Trying to say things are dysfunctional.
Yeah, it's a tough one. For us, we'll have like a dysfunctional pain classification, not movement pattern.
Yeah.
So another one is called a derangement. So you're deranged or dysfunctional. Terrible terms.
Yeah.
For pain, but the importance is in a dysfunctional pain pattern. It's whatever stress. It's not necessarily whatever stress they may have put on with you here at the gym. But it's the strain that they put on cumulative throughout the entirety of the day. Okay. Well, typically in that situation, there's a tissue that never fully healed up right. And so its capacity now has decreased from what they used to do.
Right.
Well, if now they're going to the gym, but they're still doing their normal daily life activities, whatever it may be, they're going above that strain level, and so it starts giving them problems the following day or towards the end of the day.
That's good enough. See, I'm learning.
Hey, that's all it is, man. We always keep learning.
Because that's a lot of times I'll follow up with my clients and say, okay, this might not hurt you too bad or be okay today, but let's see how you feel in the next couple of days over this. And then if that's okay, then we'll be able to continue this. And then it's a very slow, systematic progression on those. Even if they may be able to go a little bit faster, it's we just kind of take those steps and push a little bit harder, turn that dial just a tiny bit each time that they come in here. Man, that's a lot of good information. I don't know. You remember we said we couldn't do 30 minutes.
Where are we at?
We're at 11:21. So I think we're still good here. So
sweet.
we got a few more minutes. Is there anything else that you would like to just kind of talk about that you think that would as far as co-management, as far as what people's steps they can do if they feel pain. I mean, when we got people at home who are like, hey, Dr. Sprague, I have some shoulder pain right now. My knee's hurting. I really would like to exercise, but I haven't been able to. What are some things that they can do to kind of get started, or what should they think about doing?
The biggest thing for me, especially if someone's in pain, is always trying to identify what is the source of the pain, and not necessarily where is the pain, but the pain fiber. So going back to it is understanding, is this a thermal, chemical, or mechanical pain fiber? Those are the three biggest things.
Right.
Is if it's, I'm going to throw out this one, but if you touch a hot stove, put it under cold water, right? Like that one's really simple.
Yeah.
If I take an anti-inflammatory, and let's say it knocks out 40% of my pain, great, that it helped.
Yeah.
So we can know, at least in that moment of time, 40% of the pain is due to a chemical pain fiber.
Yeah.
What's left, if you didn't touch a hot stove, is 60% of the pain fibers then are mechanical. Okay.
Right.
In mechanical pain, there's typically a position or a direction that you can rest in or move through to start helping it.
That doesn't hurt. And that's what you have to identify.
That's what you have to identify. Awesome. Is my pain, which pain fiber it is, and then from there, putting in the intervention to help that pain fiber and identifying if it's what percentage, hypothetically, if I took ibuprofen, or let's go something more aggressive, let's say like gabapentin, let's say for nerve pain.
All right.
Did it knock all of it out? If it knocked, let's say either one of those situations, knocked all of it out, you have some type of chemical issue going on with your body. Okay. Maybe it's seeing Casey, maybe it's seeing a functional medicine doctor and having to do some lab tests and identify what that is. If it's a position, I'm going to say if it's a position or potentially like a time of day, if something hurts really bad in the morning, that's a lot of times a mechanical issue. That's a little caveat. But if there's a position that makes it feel bad, let's say like I've been sitting for a while and it really hurts, it tends to be a mechanical pain fiber.
Right.
So you got to load that tissue in some direction, start making it feel better.
Okay.
And typically, if you listen to that, it is the opposite direction that hurts.
Okay.
So like
opposite direction hurts. So
if
like
I touch a hot stove,
pressing patterns, right? It's the opposite, and that's what we see a lot, like overhead pressing patterns or chest presses. A lot of times we're seeing that with the rotator cuff.
And think about it, we always live here, right, with our arms.
We live,
So the opposite would be backwards.
Posterior, right?
Yeah. If I'm always living here, I go the other way, and it makes time under tension between the two, gives me yin and yang.
The opposite.
It brings harmony.
Yeah.
If I sit all the time, maybe you need to do like some Cobra press ups.
So antagonist muscle groups, right?
Yeah, it's like the opposite direction.
Yeah.
Like even forgetting what tissue it is. That's the beautiful thing about it. If you forget what tissue it is and you just listen to the movement pattern that makes it feel better, if we're in pain.
Right.
Okay, because it might not be like a functional, I'm going to say this phrase, like a joint centrated position. So let's say like neutral spine.
Right.
If I've been sitting all day and I'm in this rounded position, neutral spine might not be enough to actually get me out of it.
Right.
I need to load it in the other direction. Right. Hot stove, cold water.
Right.
Flexion hurt, extension
helps. Yeah.
Yeah, it's the opposite. And that's why I say it's actually really, really simple from the pain reduction aspect. You just got to listen to it.
Yeah.
For anyone at home watching, like just listen to your pain.
Yeah. I mean, we see the same thing just with muscular imbalances. Basically, if you have rounded shoulders, anterior is tight. We got to work the posterior part.
That's where foam rollers, was 5-6 years ago. It's like just foam roller T-spot.
Right, yeah. But it's typically the opposite of whatever's pulling in. The same thing in that, saying whatever's causing pain, you're going to work the opposite. That's really good to know. Like I said,
cool.
And we know we have a basic knowledge, and some of us even have a little specialty search. But I always tell people, like, it's always good because we only have a basic knowledge. So what I tell people, if we see hoof prints in the sand, we're automatically going to think it's a horse, not a zebra. Or somebody like a physical therapist or a chiropractor can go in there and really identify and have more. And you guys do a lot of range of motion testing and the test for pain, where that's really just it's slightly taught in some of the extensive certifications, but most of them it's not. It's just like, oh, that hurts when you do overhead press. Let's not do that anymore.
Yeah.
And sometimes we try to figure it out, and we're really happy when we're like, okay, that's what I thought it was, and Keith told you it was. So yes, I'm pretty dang smart. But in honesty, it's just not part of our education. Our part of our education really is those foundational lifts. It's not even to help people get weight loss. To be honest with you, it's to progressively improve people's strength and movement patterns.
And the weight loss is just the bonus.
Safely.
Yeah.
Yeah, that's a side product,
bonus.
which is great, and it happens. And with nutrition and Casey and all that stuff, that's when all the magic happens. But really, our job is really just to keep the public from harm, protect, teach them how to do proper movement patterns efficiently, and to also progress them through either complexity of exercising those movement patterns or through loading.
Yeah.
But 90% of people have pain.
Yeah.
I went to a pain-free performance specialty, and he asked the crowd of personal trainers that were, probably top 5% should be out of pain, and everybody held their hand. So the fact is, Dr. John Russell, which is a great guy, he said if because we're kind of not supposed to work with people with their pain somewhat in scope of practice.
There's so much overlap.
It is.
I wouldn't say beat yourself up. I know you don't, but
yeah, we have to. And that's what he said. He said if we don't work with people with pain, we don't have a job.
Yeah,
everybody has it.
Yep.
It's a very big thing. He prophesies that shoulders will outdo lower backs here in the future as the number one pain cause.
Most mobile joint in the body. Yeah, and if you can't loosely, I'm gonna say this: if you can't keep it in a centrated position, which is centration is just fancy for anyone at home that's listening. It's just a fancy way to say the joint is moving always through its center axis.
Yeah.
So it's keeping that right amount of tension of muscular activation and ligamentous activation.
Yeah.
It's not technically right on the ligament, but it's holding the right amount of integrity with whatever position it's in.
Yeah.
Whoever can load that the best tends to win because they don't get hurt.
Yeah. So, Keith, I think that was a lot of great information out here.
Good.
You want to plug your place one more time?
Yeah,
in case
sure.
Anybody does have questions and saying I have pain, and I would like to reach out to somebody.
Yeah.
They know
we have 2 locations here in Wichita. One is across the street from Bradley Fair. And the other one is on Maple and Ridge across the street from the Lowe's parking lot. So we got a west side and east side location. We wanted to do that intentionally so that way wherever someo's at in Wichita, we can really try to help support you within 15 minutes.
Yeah,
so that was our goal.
Change
Wichita's health, just like you.
Yeah, that's good. Yeah, and I'm so happy that we have partnerships with you, that we have people that we can send our clients. We care so much about them, and I can obviously tell that you care so much about yours, and that we can co-manage. We don't have to separate and take that whole $100, like you said, and we can really help people. So I enjoy being out with you. We might have to go out for a beer.
I'm always good for that.
A beer and talk a little bit more and see what other stuff you can help me out with. So.
Cool.
All right, I'll buy yours. So I'll pay for yours.
That's all good.
All right, thank you, Healthy Living Wichita. Hope you enjoyed this. We will see you next week for whatever that podcast is.
Awesome. All right, bye.
Thank you for listening to the Healthy Living Wichita podcast with Go Time Training. If you enjoyed today's show and want to get started with your own fitness journey, I'd love to help kickstart your goals. How do 4 60-minute personal training sessions for $99 with me sound? Head over to www.gotimetraining.com/podcast to claim yours. I can't wait to meet you.